Hello everyone. So let's discuss some more question of gynecology. Let's start with the question number 1. The nurse from the nursery is bringing a newborn to the mother's room. The nurse took care of the mothers yesterday and knows the mothers and baby well. The nurse should implement which action next to ensure the safety transition of the infant to the mother? So read 4 options. What can be the correct answer? Complete the hospital identification procedure with mother and infant. वैसे nurse mother और infant दोनों को जानते हैं, but to ensure the safety of mother and the infant, we have to complete the whole identification procedure. So answer number 4 will be the correct one. Now let's read the next question, that is 2. A client is in the first hour of her recovery after the vaginal birth. During the assessment, the lochia is moderate, bright red, and thickening from vagina. The nurse locates the fundus at umbilicus, is firm and midline with no palpable bladder. The client's vital signs remain in baseline. Based on the information, the nurse would implement which action? So read all the 4 options and let me know the right answer. So answer number 3 will be the correct answer, because जो लोकिया का कलर है वो कभी भी bright red नहीं होना चाहिए. So third one will be the correct answer. Now let's discuss the next question. The nurse is caring for a multigravida woman who is 1 day postpartum following a vaginal birth. Which finding indicates the need for further assessment? So the question is talking about 1 day after postpartum. So answer number 4 will be the correct answer, because the temperature should not increase after 24 hours. It will indicate infection. First 24 hours के अंदर अगर temperature elevate करता है, that is a normal finding. But after 24 hours, it can indicate infection. The nurse is providing follow-up care for the client 10 days after the birth. The nurse should anticipate what outcome from the new mother. So it's a starter question and you have to choose more than one option. So what can be the right answer? Answer number 1, 2, 3 and 5 will be the correct one. Now next question. The client gave birth vaginally 2 hours ago, has a 3rd degree laceration. There is ice in the place on her perineum. However, her perineum is slightly edematous. The client is having pain rated 6 on the scale of 1 to 10. Which nursing intervention would most appropriate at this time? So you have 4 options and let me know the correct answer. Because the pain intensity is very high, we have to administer pain medication. Next question. A primary gravid client gave birth vaginally 2 hours ago with no complication. As a nurse planned care of the postpartum client, which postpartum goal would we have highest priority? So it's a question of priority. So you have 4 options. Read all the options and choose the priority answer. So answer number 2 will be the correct one. The nurse will demonstrate self-care and infant care after the shift. 7th question. In response to the nurse question about how she is feeling, a postpartum client state that she is fine. She then being talking to the baby, checking the diaper, asking the infant care questions. The nurse determines the client is which postpartum phase of psychological adaptation. So what can be the right answer? So as the symptoms are there, these are the symptoms of taking hold, which is a normal. Now 8th question. At which location would the nurse expect to palpate the fundus of a प्रीमीपेरस clients immediately after the birth of neonate. So कहाँ हम palpate कर सकते हैं? Read all the option carefully and let me know the right one. So answer will be first, that is halfway between umbilicus and symphysis pubis. Next question. The nurse assesses a swollen comoid area of a right episiotomy on a primiparous client 6 hours after the vaginal birth. Which should be the nurse do next? After episiotomy, which action should the nurse take? So choose the right one. First will be the correct one. Apply the ice pack to the perineal area to promote vasoconstriction and to reduce pain. Now next question. 2 hours after the vaginal birth under epidural anesthesia, a client with midline episiotomy ambulates to the bathroom to void. After voiding, the nurse assesses the client's bladder, finding it distended. The nurse interprets this finding based on the understanding that the client's bladder distension is most likely to caused by which factor? So you have four options on the screen. What can be the right reason for bladder distension? Fourth answer will be correct one. Edema in lower urinary tract area. Next question. A premiparous client who is bottle feeding her neonate at 12 hours after birth asks the nurse, when will my menstrual cycle return? Which response by the nurse will be most appropriate? So read all the option carefully and let me know the right one. Second will be the correct option. It will back at 6 to 10 weeks before it starts again. 12th question. While the nurse is preparing to assist the premiparous client to the bathroom towards 6 hours after the vaginal birth under epidural anesthesia, the client says that she feels dizzy when sitting up on the side of the bed. The nurse explained that this is most likely to caused by which factor? So what can be the right reason for this? Fourth will be the correct option. The decreased blood volume in vascular system, जिसकी वजह से hypertension feel होगी, dizziness feel होगी. So this will be the reason of this condition. Now 13th question. 3 hours postpartum, a primiparous client's fundus is formed and midline. On perineal inspection, the nurse observes a small constant trickle of blood. Which condition should the nurse assess further? So choose the right answer. So we have to assess for perineal laceration. 14th question. A postpartum checkup 11 days after birth, the nurse asks the client about the color of her lochia. Which color is expected at 11 days? So white will be the correct answer because starting में हमको lochia rubra आता है, that is red in color, or in 12th days or in last days we can see white color of lochia. Now 15th question. After instructing a primiparous clients about episiotomy care, which client statement indicates successful teaching about episiotomy? So choose the right answer. Second will be the correct option. I will wipe the area from front to back using a blotting motion. Now 16th question. A primiparous client 20 hours after birth asks the nurse about starting postpartum exercises. Which instruction would be most appropriate to include in plan of care? So which position will be good after postpartum? Choose the right option. Third will be the correct one. Flex the knees while supine and then inhale deeply and exhale, contracting the abdominal muscle. इससे हमारी जो abdominal muscle है वो काफी ज़्यादा strengthen हो जाती है. Next question 17. A multiparous client whose fundus is firm and midline at umbilicus 8 hours after the vaginal birth tell the nurse that when she ambulated to the bathroom after sleeping for 4 hours, her dark red lochia seemed heavier. Which information would the nurse include when explaining the client about the increased lochia on ambulation? Read all the option, which will be the correct one. Second will be the correct option, and that is absolutely normal. The increased lochia occurs from लोकिया पुलिंग इन विजाइना. सो विजाइना के अंदर जो ग्रेविटी पुलिंग इफेक्ट की वजह से काफी टाइम से कोई स्लीप कर रहा है उसके बाद स्टैंड होकर वॉशरूम की तरफ एम्बुलेट कर रहा है, दैट कैन इंक्रीज द फ्लो. सो दिस इज द नॉर्मल फाइंडिंग. Now 18th question. A primiparous client who gave birth vaginally 8 hours ago desired to take shower. The nurse anticipates remaining near the client to assess for which condition. सो 8 आवर्स एगो ही उसने विजाइनली बर्थ किया है. सो किस कंडीशन को हमको चेक करना है? सो द राइट आंसर विल बी 2, दैट इज फेंटिंग. सो मदर फेंट कर सकती है, तो वी हैव टू असेस फॉर दिस कंडीशन कि अगर वो बात करने जा रही है तो हम उसकी फेंटिंग चेक करें, क्योंकि उसको डिजीनेस भी फील हो सकता है, फेंटिंग फील हो सकता है, क्योंकि वो फर्स्ट टाइम शार ले रही है आफ्टर गिविंग अ बर्थ. Now next question. A primiparous client who gave birth 12 hours ago under epidural anesthesia with a midline episiotomy tells the nurse that she is experiencing a great deal of discomfort when she sits in a chair with the baby. Which instruction would be most appropriate? So she is feeling discomfort while sitting with the baby. So which will be the correct answer? Second will be the correct one. To decrease pain, squeeze your buttock muscles together before sitting down. Next question. Which information would the nurse include in primiparous clients' discharge teaching plan about measures to provide visual stimulation for neonate? So किस तरीके से हम neonates को visual stimulation दे सकते हैं? Read all the option carefully and let me know the right one. Maintaining eye contact while talking to the baby increase the stimulation, visual stimulation. Now next question. An adolescent primiparous client 24 hours postpartum asks the nurse how often she can hold her baby without spoiling him. Which response would be appropriate? Second will be the correct answer. Hold him as much as you can. Because in the starting days, in 24 hour after postpartum, बेबी एंड मदर का ट्रस्ट का बॉन्ड बनता है, जिसकी वजह से जितना ज़्यादा मदर या फिर उनके पेरेंट्स बेबी के साथ टाइम स्पेंड करेंगे उतना ही ज़्यादा ट्रस्ट बिल्ड होगा. सो दिस इज द टाइम वेयर बेबी गेव ट्रस्ट और मिसट्रस्ट. Now next question. On the first postpartum day, the primiparous client reports perineal pain 5 on the scale of 1 to 10 was unrevealed by ibuprofen given 2 hours ago. The nurse should further assess the client for which complication. So which complication can be there if the pain is not reducing by even ibuprofen? So the right answer will be perineal hematoma. We have to look for perineal hematoma क्योंकि जो पेन है वो ibuprofen से भी नहीं जा रहा है, काफी ज्यादा सीवियर पेन. Now next question. The nurse working on a postpartum unit is in the charge of the team that includes an UAP. Which task should the nurse question if the UAP caring for 1 day postpartum client? So ऐसा क्या UAP ने किया जो कि वो नहीं कर सकती थी? So read all the option and let me know the correct one. Second will be the correct option, teaching the mother to latch the infant into the breast. क्योंकि UAP की practice के अंदर teaching नहीं होता, UAP cannot teach the client. Now next question, that is 24. While the nurse is caring for a primiparous client on the first postpartum day, the client asks, How is that woman doing who lost her baby from prematurity? We were in the same labor together. Which response by the nurse will be appropriate? If the patient is asking about another patient in the ward, which response will be the appropriate? So fourth option will be correct one. Explain the client that nurses are not allowed to discuss a client's in unit. Now next question 25. A newly postpartum primiparous client asks the nurse, can my baby see? Which statement would be the neonatal vision should the nurse include in explanation? Second will be the correct answer. They can see objects up to 12 inches away. 26th question. While assessing the fundus of a multiparous client 36 hours after the birth of a term neonate, the nurse note a separation of abdominal muscle. What should the nurse tell the client? So read all the options and what can be the right one. Fourth will be the correct one, to perform exercise involving head and shoulder rising in position that will strengthen the abdominal muscle. Next question. An postpartum client gave birth 6 hours ago without anesthesia and just weighed 100 ml. The nurse palpates the fundus 2 finger breadths above the umbilicus and of the right side. Which should the nurse do first? Read all the option and let me know the correct one. So, if the fundus palpates 2 finger breadths above the umbilicus and take off to the right side, that indicates the bladder is full. So अगर ब्लैडर फुल हो चुका है तो हमको क्या करना चाहिए? Catheterize the client to empty the bladder. Now next question 28. While the nurse is assessing the fundus of a multiparous client who gave birth 24 hours ago, the client asked, what can I do to get rid of these stretch marks? Which response should the most appropriate one? So you have 4 options. What can be the right one? Second will be the correct option. They usually fade to the silvery white color over the period of time. Now next question. A primiparous client who gave vaginal birth to a viable term unit 48 hours ago has a midline episiotomy and repair of third-degree laceration. Which preparation for the client for discharge, which assessment would be most important? So एपिजियोटमी की अगर बात हो रही है तो क्या चीजें, उसको ऑलरेडी लेसरेशन है तो हमको क्या चीज असेस करनी चाहिए? कॉन्स्टिपेशन विल बी द करेक्ट आंसर. Now next question. In preparing for a discharge, the nurse discussed sexual issues with a multiparous client who had a routine vaginal birth with a midline episiotomy. The nurse asked, I have heard recommendation about when to resume intercourse have changed since my last baby. What are they saying now? When should the nurse instruct that the client can resume sexual intercourse? So, what can be the right answer? So, किस condition के बाद they can do all this? Answer number 4 will be the correct answer. When lochia flow and episiotomy pain have stopped. After that, they can resume their sexual activities. Now, next question. While caring for a multiparous client 4 hours after vaginal birth of a term neonate, the nurse noted that the mother's temperature is 99.8, that is normal, and the pulse is 66 beats per minute, respiration is 18 beats per minute, her fundus is firm, midline, and at the level of umbilicus. What should the nurse do? We are talking about 4 hours after vaginal. टेम्परेचर थोड़ा सा एलिवेट है तो ये नॉर्मल कंडीशन है, क्योंकि आफ्टर 24 आवर्स टेम्परेचर अगर इंक्रीज होता है तो दैट कैन इंडिकेट इन्फेक्शन, बट अगर टेम्परेचर इंक्रीज है वो नॉर्मल फाइंडिंग है अगर जस्ट आफ्टर डिलीवरी है या फिर विद इन 24 आवर्स आफ्टर डिलीवरी है. So just continue to monitor the vital signs will be the correct answer. Now next question, that is 32. While assessing the episiotomy site of a primiparous client on the first postpartum day, the nurse observed a fairly large hemorrhoid at the client's rectum. After instructing the client about measures to relieve hemorrhoid discomfort, which client statement indicates need for further additional teaching? So which will be the right one? Answer number 3 will be the correct answer because this is the false answer. I should lie on my back as much as possible to reduce the pain. Back पे तो कभी lie करना ही नहीं. The patient should be in Sims position to reduce the pain. Now next question. A primiparous client is on a regular diet 24 hours postpartum. The client mother asks the nurse if she can bring her daughter home special foods from home. The nurse responds based on understanding which principle? It's 24 hours postpartum. So what will be the right response? Second will be the right answer because after delivery, after 24 hours, they can eat anything. So the mother can brought all the things. Next question, a primiparous client for 48 hours after vaginal birth is to be discharged with a prescription of vitamins and iron because she is anemic. To maximize absorption of iron, the nurse should instruct the client to take which medication? To increase the absorption of iron, that is orange juice. Next question, the nurse is caring for a multiparous client after vaginal birth of a set of twins 2 hours ago. The nurse should encourage the mother and partner to do what? They are twins, right? So which education we can give? 4 will be the right answer. Relate to each twin individually to enhance attachment properly. 12 hours after vaginal birth with an epidural anesthesia, the nurse palpates the fundus of a primiparous gland, finds it to be firm above umbilicus and ready to write. What should the nurse do next? So what will be the right answer? ये किसकी वजह से हो सकता है फंडस ऐसे? बिकॉज ऑफ ब्लैडर डिस्टेंशन, राइट? सो हमको क्या करना है? उनको इनकरेज करना है कि वो एम्बुलेट करें, वॉशरूम जाएं एंड वॉइड करें. Now next question. The nurse is discussing discharge instruction with the client. This which statements indicate the client's understanding that resources and information available if needed after discharge. It's a SATA question and you have to select more than one option. Answer number 1 will be the correct, second will be the correct, third will be the correct answer. 6 will also be the correct answer. I will continue my prenatal vitamins until the postpartum, which is longer. What else can be the right answer? Fifth will also be the correct answer. I know if I get fever or chills on change in my lochia, I will call the HCP because this is a sign of infection and change in color of lochia. We have to report the physician. Now next question, 38. The nurse is reviewing discharge instruction with a postpartum breastfeeding client who is going home. She has chosen medroxyprogesterone acetate injection as birth control. Which statement by the client indicates that she needs further instruction concerning birth control? So medroxyprogesterone से वो अपना बर्थ कंट्रोल की बात कर रही हैं, सो व्हाट कैन बी द राइट आंसर, कि कौन सा आंसर के अंदर उनको फर्दर इंस्ट्रक्शन की जरूरत है. Because the mother is breastfeeding. So if she says, you will give me first deposit injection before I leave today, because the mother is breastfeeding and she wants injection now. So this will be the false statement, because in breastfeeding we cannot provide this injection. Next question. A postpartum primiparous client is having difficulty in breastfeeding her infant. The infant latches on the breast, but the mother's nipples are extremely sore during and after each feeding. The clients need further instruction about breastfeeding when she make which statement. Answer number 3 will be the correct option. As long as some of my nipple is in the baby's mouth, the babies receive enough milk will be a false statement and need further instruction. Next question. The nurse is caring for a primipara which gave birth yesterday and has chosen the breastfeed her unit. Which assessment finding is considered unusual for the client at this point? She has given the birth yesterday. So which will be the correct option? Because the new mothers usually begins to produce milk at third day after postpartum and colostrum is normally produced until that time. So milk production will be the correct answer. So let's say next question, that is 42. A breastfeeding client is seen at home by visiting nurses 10 days after the vaginal birth. The client has a warm red painful breast, a temperature of 100 degrees Fahrenheit and a flu-like symptom. What should the nurse do? Read all the option and let me know the right answers. Because the client is exhibiting the sign and symptom of breast infection, the nurse should contact the HCP very soon. So answer number 2 will be the correct one. Next question. A diabetic postpartum client plans to breastfeed. The nurse determines that the client understanding of breastfeeding instruction is sufficient when the client make which statement. So which statement will be the correct one about breastfeeding? So what can be the right answer? So answer number 4 will be the correct one. Breastfeeding will assist in lowering maternal blood glucose. वो कैसे हो सकता है? Because breastfeeding consume maternal calories and require energy and increase the maternal basic metabolism rate. तो जिसकी वजह से maternal blood glucose जो होगा वो कम हो सकता है. Next question. 1 day old breastfed infant has bilirubin level that is at intermediate risk of for jaundice. Which statement by the infant's mother indicates an understanding of teaching regarding jaundice? So which will be the correct option? Read out the option carefully and let me know the right answer. So answer number 1 will be the correct one. I should breastfeed my baby as often as possible. So why this is the answer? Because jaundice in breastfeeding infant is common and not a pathological symptom. So mother should continue breastfeeding the baby. Now next question. During a home visit, the breastfeeding client asked the nurse what contraception method she and her partner should use until she has a 6-week postpartum examination. Which method would be most appropriate, the nurse suggests? So which will be the right answer? Answer number 1 will be the correct one. If not contraindicated in their culture, so answer number 1 will be the correct answer. So let's read the next question. A primiparous client who is beginning to breastfeed her neonate as the nurse. It's an important for my baby to get colostrum. Which instruction the nurse explained that colostrum provides the neonate with which factor? So you should know about this. What will be the right answer? Answer number 4 will be the correct one. They colostrum give passive immunity from maternal antibodies. So you can see the question number 47 on the screen. Which principles form the basis of teaching plan about avoiding non-prescription medication for a primiparous client who is breastfeeding? Choose the right answer. Answer number 3 will be the correct one because the medication may be excreted in breast milk to the nursing neonates. Because जो भी medication जो client है वो ले रहा है वो breast milk के through baby को भी जा सकता है. So हमको अवॉइड करने चाहिए ऐसी मेडिकेशन जो प्रिस्क्राइब नहीं की गई. Now next question 48. A breastfeeding primiparous client with a midline episode is prescribed ibuprofen orally. Which does the nurse instruct the client to take this medication? कब उनको वो मेडिकेशन लेनी है? So it will be the right answer. So immediately after feeding will be the correct response. क्योंकि फीडिंग करने के बाद अगर वो आइबुप्रोफिन लेंगे तो उनकी नेक्स्ट फीडिंग तक आइबुप्रोफिन का लेवल बॉडी के अंदर कम हो चुका होगा. So it will be the correct response. Next question. A multiparous client 28 hours after the cesarean birth who is breastfeeding and severe cramps on or after pains. The nurse explained that these are caused by which factor? So we are talking about 28 hours after the cesarean birth. So which will be the right answer? Fourth will be the correct answer. Release of oxytocin during the breastfeeding session, which cause uterine muscles to constrict. This constriction account for discomfort associated with after pains. Now let's read the next question, that is 50. After the nurse conceals a primiparous breastfeeding client about diet and nutritional needs during the lactation period, which client statement indicates the need for further teaching? काउंसिल्स के टाइम पे क्या चीज़ जो है वो क्लाइंट अगर बोले तो उनको फर्दर टीचिंग की ज़रूरत है. So read all the option carefully and let me know the correct response. So answer number second can be correct answer because I should drink at least 5 glasses of fluids daily. But during breastfeeding, we have to increase the water content at least 8 to 9 glasses. So this is the false statement. Now next question, that is 51. A breastfeeding primiparous client asks the nurse how breast milk differs from cow milk. The nurse responds by saying that breast milk is higher in which nutrient? That is fat. Now next question. While assisting a primiparous client with her first breastfeeding session, the nurse should instruct the mother to perform which action in order to stimulate the neonate to open the mouth and grasp the nipple? Which instruction should the nurse give? Answer number 4 will be the correct answer. That is, bridge the neonate's lips slightly with the nipple. जिससे वो अपना माउथ ओपन करेंगे and they will start breastfeeding. Now next question 25-year-old primiparous client which gave birth 2 hours ago decided to breastfeed her neonate. Which instruction should the nurse address highest priority in teaching plan about previous nipple soreness? Which will be the correct option, and you have 4 options. Choose the right one. Answer number second will be the correct answer, placing as much of areola as possible in baby's mouth. Now next question, which client statement indicate effective teaching about burping a breastfed neonate? Which will be the correct answer? You have four options. Answer number 4 will be the correct response. When I will switch to another breast, I will burp the baby. Now, next question. After the nurse teaches the primiparous clients planning to return to the work in 6 weeks about storing breast milk, which statements indicate the client need further teaching? So we are talking about storing the breast milk. So which will be the false statement that needs further teaching? So choose the correct answer. Answer number 3 will be the correct answer. I must discard any breast milk stored for more than 3 days will be the false statement. Because the fresh breast milk can be safely kept in the refrigerator for 5 to 7 days. We can store it. It will not get that much bad because we can store it for 5 to 7 days and we can give the milk to the baby. Now, next question, that is 56. During the home visit on a fourth postpartum day, a primiparous client tells the nurse that she is aware of let down sensation in her breast and asks the causes. Which nurse explanation of let down causes sensation is caused by which hormone? Which will be the correct answer? So, the correct answer will be oxytocin, because the oxytocin stimulates the let down reflex when the milk is carried out to the nipple. Now, next question, that is 57. During the home visit on a fourth postpartum, the primiparous client tells the nurse that she has been experiencing a breast engorgement. To relieve engorgement, the nurse teaches the client to use which intervention before nursing her baby? So, which will be the correct answer? So, answer number 3 will be the correct one. Express a small amount of breast milk. इससे क्या होगा? हम मसाज करते हैं या फिर warm shower लेते हैं before breastfeeding, that will stimulate the flow of breast milk properly, so we can express a small amount of breast milk will be the correct response. Now, next question, that is 58. A breastfeeding primiparous client who gave birth 8 hours ago asked the nurse, how will I know that my baby is getting enough to eat? Which guidelines should the nurse include in teaching plan as evidence of adequate intake? So you have four options and let me know the correct one. So answer number 1 will be the correct one. 6 to 8 wet diapers by 5th day will be the correct answer. Because जितना ज़्यादा वो मिल्क इनटेक कर रहा है उतना ही ज़्यादा फ्लो यूरिन पास करेगा. So if he wait 6 to 8 wet diapers by 5th day will be the correct response. Now, next question. Which information should the nurse include in teaching plan for a primiparous client who ask about weaning her neonate? So which will be the correct teaching? Four answer will be the correct one, that is gradually eliminate one feeding at time will be correct response, because the client should wean the infant gradually eliminating one breastfeeding at time. Now, next 60th question. The nurse is caring for a client who is 3 day postpartum and breastfeeding her baby. The following assessment is made by the nurse. Episiotomy area is red admittance. Breast is firm and tender on palpation. Fundus firm. Two finger breaths below the umbilicus. The nurse action are indicated. It's again a starter question and you have to choose more than one option. So which options will be correct one? Read all the option carefully and let me know the right answer. Answer number one will be the correct one because the client is experiencing symptom of engorgement. What else will be the correct one? Answer number three will also the correct one. Ask the client how often the baby feeds. Now next question, that is 61. 2 weeks after the breastfeeding primiparous client is discharged, she calling the birthing center and says that she is afraid she is losing my breast milk. The baby had been nursing every 4 hourly, but now she is trying to be fed every 2 hours. The nurse interprets the neonat's behavior as most likely caused by which factor? Choose the right one. You have four options. So answer number four will be the correct answer because the neonates temporary growth spurts which require more feeding. Neonates normally increase breastfeeding during the periods of rapid growth. So four will be the right answer and the expected is days are 10 to 14 days. Now next question. During the home visit to a breastfeeding primiparous client at 1 week postpartum, the client tells the nurse that her nipples have become sore and cracked from breastfeeding. Which instruction should the nurse give to the client? Even if the nipples are sore and cracked, the mother should position the baby with entire areola in the baby's mouth so that the nipple is not compressed between the baby's gum during the breastfeeding. So answer number two will be the correct one. Now let's read the next question, that is 63. A new father indicates he feels left out of the family relationship since he is not able to bond the same way as breastfeeding mother. What's the most appropriate response by the nurse about the father? So you have four options and choose the right one. Second will be the correct answer. Holding, talking to, and playing with the infant will increase the dad and baby bonding. Now, next question, that is 64. A triage nurse is pediatrician office returns a call to the mother who is breastfeeding her 4-day-old infant. The mother is concerned about the yellow sheath stool that has developed since discharge home. What is the best response by the nurse? So I have four options. What can be the right answer? So answer number four will be the correct one. Soft, shady, unformed stools with each feeding are normal at age will continue with after breastfeeding. So जैसे जैसे breastfeeding कंटिन्यू होते है स्टार्टिंग में तो meconium आता है जस्ट आफ्टर द बर्थ उसके बाद जैसे जैसे बच्चा ब्रेस्ट फीड कर रहा है उसके बाद उसके स्टूल का कलर और softness increase हो जाती है. So that is a normal finding. No need to report. Now next question, that is 65. The nurse is assessing a client at her postpartum checkup 6 weeks after a vaginal birth. The mother is bottle feeding her baby. Which findings indicate a problem at this time? So which will be the correct option? So answer number one will be the correct one. That is a firm fundus at symphysis pubis. By the week 4 to 6 after postpartum, the fundus should be in deep in pelvis and as the size of postpartum, non-pregnant women uterus. So this is the wrong finding. Now let's read the next question. The client gave birth 2 days ago and has been giving instruction on a breast care for a bottle feeding mothers. Which statement indicates that the nurse should reinforce the instruction to the client? So which will be the correct response? Answer number 4 will be the correct one. I will use a breastfeed pump to remove any milk that may appear. Now next question, that is 67. A 24-year-old premipara who has given birth to a healthy neonate plans to bottle feed her neonate. Which information regarding normal weight gain should the nurse include in teaching care plan? So what will be the correct answer? You have four options and choose the correct one. Answer number 3 will be the correct one. Gaining 30 gram per day is a normal weight gain pattern. Now next, a primiparous client with a neonate who is 36 hours old asks the nurse, why does my baby spit up a small amount of formula after feeding? The nurse explained that regurgitation is thought to result from which factor? Which will be the correct answer? That is an immature cardiac sphincter. And early regurgitation in neonate is during first 12 to 24 hours, may be caused by excessive mucus and gastric irritation from foreign substances. Now next question, that is 69. A premium pairs client who will be bottle feeding her neonate asks what is the best position for the baby to nap after feeding? Which position should the nurse recommend? That is supine position. Now next question, that is 70. A primiparous client who is bottle feeding her neonate asks, when should I start giving the baby solid foods? The nurse instruct the client to introduce solid foods no sooner than which age? So you have four options. Which will be the correct age to start solid food? That is 6 months. 6 मंथ से पहले कभी भी सॉलिड फूड नहीं देना चाहिए, मिल्क पर ही बच्चे को रहना चाहिए. Now next question. After instructing a primiparous client who is about a bottle feeding about burping, which client statement indicates that the client needs further teaching? So read all the options carefully and let me know the right one. Answer number 1 will be the correct one. I will burp him after 15 minutes of breastfeeding his formula. This is too late. Even पूरी भी breastfeeding मतलब baby feeding time में 15 minutes लगता है, तो in between भी फीड करना चाहिए बेबी को और बर्प कराना चाहिए. Now next question 72. When teaching a primiparous client about the growth and development of a neonate, the nurse should explain the most babies are able to drink from sippy cup at which age? That is 8 to 10 months. Next question, that is 73. The nurse reviews the contraception choice of a bottle feeding postpartum client prior to discharge. The client wants to know why she needs to wait to resume the use of oral contraceptives. What is the nurse's best response? So this is good question and you have four options and let me know the right one. So answer number 3 will be the correct one because pregnancy and immediate postpartum is that coagulation उस टाइम पर ज्यादा होती है एंड रिस्क क्या होगा ब्लड क्लॉट्स होने का होगा. अगर हम कॉम्बिनेशन में इन दोनों चीजों को लेते हैं that will increase the further risk of blood clotting. Now next question. The nurse places inflatable compression sleeve on the legs of a client undergoing a cesarean birth under regional anesthesia. When does the nurse tell the client that sleeve should be removed? So you have four options, and what can be the right response? So the right answer will be 3, when the client resume ambulation. So next question, the nurse is assessing a client who had a cesarean birth 12 hours ago. Findings include a distended abdomen and faint bowel sound. One quadrant fundus format, umbilicus, locus, scant rubra and pain 2 on a scale of 1 to 10. The IV and a Foley catheter had been discontinued. The client received medication 3 hours ago for pain. The client can have pain medication every 3 to 4 hours. What should the nurse do first? So read the question and option carefully and let me know the right answer. The client should have more active bowel sounds by this time of postpartum. Ambulation will increase passing, flats and being. So what will be the correct answer? Ambulates the client from bed to hallway will be the correct response. Now next question. Carboprost was injected into the uterus for the client treat uterine atony during the cesarean birth. In preparing to care for the client's postpartum, the nurse should assess the client for which common adverse effect of this medication. So what can be the adverse effects? That is nausea and diarrhea will be the correct answer. Now let the next question. A multigravida 30-year-old woman has given cesarean birth into the healthy term unit due to an abnormal fetal heart racing. At 2 hours after postpartum, the nurse assessed the client's urinary catheter and observed that the client's urine is slightly red tinted. What should the nurse do next? Choose the correct response. So the indication of blood indicate the bladder was accidentally cut during the cesarean birth. So we have to notify the HCP immediately. 4 hours after cesarean birth of a neonate weighing 8 lb, that is 13 oz 4000 gram, a primiparous client asked, if I get pregnant again, will I need to have a cesarean? When responding to the client, the nurse should base the response to the client about vaginal birth after cesarean on which standard of practice. You have four options on the screen and choose the correct option. So VBAC can be attempted if the client has not had a classic uterine incision. So first will be the correct answer. Now next question, that is 79. A primiparous client who underwent a cesarean birth 30 minutes ago is receiving anti-immunoglobulins. The nurse should administer the medication within which time frame after the birth? That is 72 hours. So 4 will be the correct answer. Now next question. While the nurse is caring for a primiparous client with a cephalopelvic disproportion 4 hours after the cesarean birth, the client requests assistance in breastfeeding to promote maximum maternal comfort. Which position would be the most appropriate to suggest? Short will be the right answer. So after the cesarean birth, most mothers have greatest comfort when the neonate is positioned in a football hold with the mothers in semifolars position. So answer number 1 will be the correct response. Now let's talk about the postpartum clients with complication. Let's read the question number 81. A multi-gravid client gave birth vaginally 2 hours ago and the family members notifies the nurse that the client is pale and shaky. Which are the priority assessments for the nurse to make? Choose the right answer. You have four options. So that can be by an hypovolemic shock caused by blood loss. So the right answer will be what? Choose the correct one. अगर ज़्यादा ब्लड लॉस होगा, क्यों होगा ब्लड लॉस? यूट्राइन एटोनी हो सकती है जस्ट आफ्टर द बर्थ. तो हमको क्या चीज़ असेस करनी चाहिए? देयरफॉर द प्रायोरिटी असेसमेंट शुड बी द फंडस एंड यूट्रस फॉर्मनेस. तो हमको लोकिया चेक करना है कि लोकिया का लेवल सही है या नहीं, लोकिया का अमाउंट इंक्रीज तो नहीं हो रहा है, लोकिया कलर क्या है एंड फंडस की टोन कैसी है. Next question. A postpartum woman has undergone pain in her rectum after vaginal birth despite administration of pain medication. Which action is most indicated? And you have four options. Choose the correct one. So assessing the perineum will be the correct response. Answer number 2 will be the correct one. Now next question, that is 83. A multiparous client at 24 hours postpartum is found to have swelling and pain in her right leg. She demonstrates a positive Homan sign with discomfort. What should the nurse do next? So read all the options and let me know the correct one. So the pain and swelling may indicate what? That is thrombophlebitis. So what should we do? We have to notify the HCP immediately. So answer number 3 will be the correct one. Now next question, that is 84. Prophylactic heparin therapy is prescribed for treatment of thrombophlebitis in a multiparous client who gave birth 24 hours ago. After instructing the client about the medication, the nurse determines that the client understands the instruction when she states which affect as a purpose of this drug. So you have four options and choose the right one. To prevent the blood clotting. Next question. While caring for a postpartum client who is receiving treatment with bed rest and IV heparin therapy for deep vein thrombosis, the nurse should contact the HCP immediately if the client exhibit which symptom. So which will be the right answer. So जो major complication होती है that is deep vein thrombosis की pulmonary embolism. So deep vein thrombosis के अंदर pulmonary embolism हो सकता है, तो we have to monitor for dyspnea. So answer number 2 will be the correct one. So it was all about today's question and we are going to discuss some more question in our next class.